health is a human right. That is embedded in everyone's right. And for me, I say that health is the most fundamental human right. Without the right to health, you cannot enjoy other rights. You cannot enjoy the right to vote, for example, if you're not healthy. You cannot enjoy the right to education if you're not healthy. You cannot enjoy the right for political participation if you're not healthy. So when you start from there, that right, then you say that everyone deserves the access to the health services they need, whether they are promotive, like ensuring that people understand how to keep themselves healthy, which is a fundamental a vision of all of us, to keep people healthy, because disease is expensive to manage. The understanding that there is means to prevent yourselves and your children and your families and your communities from disease. The understanding that when somebody actually gets ill, they should be able to access the services they need without financial difficulty. That is really what universal health coverage is. That you can access those services nearest to where you live, nearest to where you work, and nearest to where you play. That is primary health care. That actually around you, within the houses that you live in, and within the lives that you lead and you live, healthy services are available to you within that community without having to travel distances to find it, because that then gets you out of your daily life. So universal health coverage is ensuring that there is this context that is rights-based, that addresses the challenges of people where they are, where they live, and that we remove financial difficulties. So our approach means that we can inform governments about these different nuances, about these different contexts that people live in, and therefore governments can then, from our knowledge at community level, we can take that upwards, horizontally, so that governments can adapt their policies. So understanding this concept of universal health coverage means that always being sensitive to vulnerabilities, because when you're talking about providing services without financial difficulty, it is actually those who are most vulnerable that must be our focus. It's not those who are able to afford, it's those who are most vulnerable, who are having cycles of vulnerability, that should be the centrality of this concept of providing health services, rights-based health services where they are without difficulty. And that is why community-led, people-centered programming for health is the most critical thing in achieving those services in a way that people can't find difficulty in accessing them.